Good evening. Welcome to Montgomery County Vice President Tom Hucker's virtual town hall. We'll be starting in just a few minutes, giving time for attendees to join. Hello and welcome to our virtual town hall. We'll be starting in just a few minutes. We're giving participants time to join. Good evening. Welcome to Montgomery County Council Vice President Tom Hucker's virtual town hall. We're excited that you've joined us tonight for another important event about COVID-19. Please use the Q&A feature to raise a question. We'll do our best to answer as many questions as we can during tonight's event. We have over 100 attendees, so if we aren't able to take your question by the end of the night, please leave a voicemail or email us so we can follow up with you as soon as possible. We also have an important survey we're using to gather information about COVID-19 from residents. If you're using Zoom, please check your toolbar and click survey to access it. Now let me turn it over to our host, County Council Vice President Tom Hucker. Tom?
Thank you, Dave. Thanks for helping to put this together. I want to thank everybody for joining us this evening, especially Congressman Sarbanes. It's really hard to believe it's been 60 days since Governor Hogan announced that Maryland's we announced our first 3 cases of COVID-19 on March 5th. In just 2 short months, our lives have been completely transformed, and worst, as of this morning, we have 5,884 cases just in Montgomery County alone, 274 confirmed deaths of our neighbors and friends, and 27 additional deaths that we think are probably due to COVID-19 as well. For those of you who haven't joined us before, this is my 8th town hall event regarding COVID-19. We've had earlier discussions with the county executive, with Tacoma Park Mayor Kate Stewart, and many issue-based events, including one focused on renters issues and one focused on services for vulnerable residents. Tonight, we're going to have an update from Sean O'Donnell, and we'll have a conversation with Congressman Sarbanes as well. But first, I wanted to provide an update on the council's work at the local level. Our county government has been working on this around the clock. We have been meeting over Zoom almost every day to help address issues in real time. We passed a relief package that's over $40 million at this point, and we keep adding to it every week. We've been targeting hotspots of cases, and we've been increasing our healthcare capacity, beginning with $10 million that we allocated to our hospitals to help them ramp up so that they would not be overwhelmed with the rising number of COVID cases, and so we could get additional beds stood up to prepare for the surge. We also spent $250,000 on hotel rooms for our medical staff and first responders so they could get some rest between shifts in the county rather than driving all the way home to their families. And we also appropriated $350,000 to secure additional personal protective equipment. And we've been working with our procurement director, our emergency management director, and our local biotech companies and others to leverage connections here in Montgomery County to get what the community needs. If you've been following the news, you know this is a crazy system. We compete with other counties, we compete with other states. Sometimes we even compete with FEMA itself to gather the personal protective equipment that we need to keep our first responders and our healthcare workers safe. So that's why we've been trying to do as much as we can to help our local manufacturers and other companies pivot to manufacture personal protective equipment here and take advantage of state grants that are available to help them in that transition. In terms of health disparities, we also successfully lobbied Governor Hogan to share the data on health disparities, which were initially not shared by the state. It was very disturbing to find out that 3 of the 4 zip codes in the state with the greatest number of cases were not only in Montgomery County, they're in Silver Spring. And zip codes are all different sizes. We know these are just the cases that we know about who have tested positive and been diagnosed. But the data certainly show that the health disparities that we have lived with, unfortunately for years, are only getting worse during COVID because people with pre-existing conditions and weak or no health insurance are more likely to become infected. We're now starting to use this data to focus our outreach and to work with our partners, such as the African American Health Program and the Latino Health Initiative at the county level, to do targeted interventions, including door-to-door outreach to people to make sure that they are taking the precautions they need to take and getting tested if they have symptoms. We're also supporting our vulnerable residents. The crisis has been impacting how residents access just their basic needs that are often taken for granted, such as food and transportation. Many of our families, are used to getting at least some of their meals from the public school system, but the public school system is closed. So that's why the council has adopted $750,000 for food security, including culturally appropriate and locally sourced food. Some of that we set aside this very week to create partnerships with ethnic grocery stores to make sure we have culturally appropriate food available to many of our families that are facing food insecurity. And we're creating a long-term plan to source more food right here in Montgomery County. We also passed a historic rent relief bill that freezes rent at 2.6% during the crisis. And I was able to introduce a successful amendment to continue that freeze 6 months after the health emergency ends. And we also have spent $2 million on rental subsidies as well to prevent evictions of our most vulnerable residents. We're doing everything we can to support our small businesses as well and our employers because we're facing a historic recession as well as a public health crisis. We're giving out $25 million in small business grants. And I've been able to reserve $5 million in the first bill, an additional $5 million later, targeted to our restaurants and retail sector because they're the hardest hit during this recession because of the need for social distancing. We're also giving out small grants to support teleworking, to allow companies to buy the software and other things that they need to allow their workforce to pivot to teleworking. And I've been heavily involved in individualized issues to support our businesses with permitting and licensing and many other issues that have come up. That's not everything the County Council is doing on COVID-19, but those are the major issues, and I'm happy to take questions later on. Please know that my colleagues and I are working 7 days a week to do our part to mitigate this crisis. Our existing government services are 100% focused on responding to this crisis. We're doing everything we can to address social service requests and tenant issues and small business issues and health and human services issues and many more. And if we can help you directly, or if we can help you contact a government agency or a business or a nonprofit partner of ours, please contact my office right away at 240-777-7960. That's 240-777-7960. And my email is just tom.hucker@montgomerycountymd.gov. So I'm eager to take your questions and feedback. We're very excited that we have Congressman Sarbanes with us tonight as well. And he's got a lot of information to share about the federal response and answer questions as well about how that affects everyone. But first, I want to introduce Sean O'Donnell, who's the manager of the Public Health and Emergency Preparedness for Montgomery County. Sean?
Thank you, Councilman Hucker.
Thank you.
Appreciate the opportunity to be here with all of you today and hope that I can give you some updates and answer some questions that might come up. As you can see, some of the numbers have already been provided to you as the updates, and I think it's important to realize, I know this has been said before, but as we continue to increase our ability to test our population, we're going to continue to find more and more cases. Some of the more important statistics about how this disease is progressing in our area does still relate to the percentage positive, and we've had a fairly steady rate of 19 to 20% of the tests that we've done are coming back positive. So it's encouraging that that number is not going up or higher, but as we test more people, if that rate stays the same, we'll continue to see more cases. We look each day at not only our cases, but our resources that are being used. potentially, particularly our scarce resources in our healthcare industry and the ICU status. We had 12% of our ICU beds available as of this morning, and our acute care beds are at 6%. Of course, there's a much larger number of acute care beds in the county. But both of those are, the acute care is holding steady, and the ICU status is a bit improved as we've seen some fewer rates of hospitalizations recently. And we have a good number of ventilators at this point. That was a very scarce commodity at one point several weeks back. But with the influx of additional ventilators, we're feeling more confident with that capacity right now. Within Health and Human Services, every day we continue to work on surging our workforce that can do contact tracing and outbreak investigations. We are, of course, doing outbreak investigations with our nursing homes and other long-term care facilities, as well as we've begun doing them with smaller congregate group homes where we've identified cases. So we continue to do a lot of work with those populations. And we are, as I said, surging our ability to do contact tracing. And we're trying to get to the point where we can be current each day with the new cases. It is challenging because the cases that are reported electronically are easier to begin. The ones that do not yet exist in the state system take a little bit longer to start. But that's our goal, to have that to be real time with each day. With the COVID testing, as I mentioned, we continue to try to increase those capacities. We did our second drive-through testing at the Germantown Up-County Regional Service Center today. We tested about 50 cases today, which is roughly doubling of what we did the first time out. We're looking at surging the testing we're doing in the White Oak Emissions Center by about 25 to 50% for each of the days we're doing there. And we're also doing at the Wheaton Center. Again, trying to focus testing capacity in our locations, as you mentioned earlier, where there are high numbers of cases already. We have been working with some of our partners in trying to expand significantly beyond that. And we're working to identify sources of self-testing kits, which would allow us to expand and potentially test all of our essential workers within a shorter amount of time, to give us a better idea of who is asymptomatically having the infection versus who symptomatically has the infection, which the latter, of course, are a little bit easier to identify. But we'd like to have a better idea with not only our healthcare workers, our other first responders, and our other essential workers across the county. So we continue to, we're putting plans in place so that when those resources become available, we can hit the ground running with that. We're also working on, and we should have hopefully within the next 7 days, an ability to do some telemedicine screening of individuals who do not have other means to be screened for receiving testing. Actually ranging from Saturday through today and tomorrow, we're completing our 4th facility-wide distribution of PPE to our nursing homes and large assisted living facilities. There are 70 of these in the county, and we've been basically providing them a 2-week supply to ensure that they have enough supplies of PPE. Unfortunately, that doesn't not currently include a large supply of gowns. That has been the most difficult PPE item to resource. And we are working with our state partners. We're working with procurement to try to find any sources of those. We did distribute some gowns today to our nursing homes, but we're just actively trying to find more. I know that's been something that a lot of healthcare partners are looking for, including our hospitals and other healthcare partners. We ran some analytics today on what we've been doing as far as PPE, and we've done more than 580 distributions over the last 40 days since we started this, which averages out to a little more than 14 per day. And the significant majority of PPE has gone to those long-term care facilities, followed by hospitals, primary care providers, and our group homes. We are currently working on a second distribution to, speaking of those group homes, to our both our developmentally disabled associated homes and the other congregate care settings to, again, try to prevent any additional outbreaks or control outbreaks that are occurring in those settings. And we know our partners at the Office of Emergency Management and Homeland Security and General Services are continuing to make procurements of the cloth face coverings, and those have been distributed out to our essential employees who are still working on site and front facing, and they'll continue to distribute those out as they become available. And I believe they have a plan for beginning to distribute them to our senior populations as well, which that's very encouraging given the limited amount of medical grade PPE. We are also standing up, this is a statewide program called the Caregiver Mission, and it is a program that allows individuals whose caregivers are unable to support them the way they normally do to reach out to the Maryland Responds volunteer program, request support, and then our Medical Reserve Corps volunteers respond that they're able to support that mission, and we are helping them by ensuring they have PPE in our county and can go out and do that. It's a vitally important thing to make sure that these individuals are not left alone at home without help. And then we continue to work on medical surge with both our state and healthcare partners in the development of additional bed capacity in the county. I know there's been some progress made both with the Shady Grove Tacoma Park campus, as well as some other partners who are looking at expanding some of their capacity. And we continue to add new volunteers to the Medical Reserve Corps. So those are the major updates as of today, but I'm happy to expand on any of these if you would like, or answer any questions.
Thanks so much, Sean, for joining us tonight. I think we'll do all the questions at the end of just a minute. And thanks, Sean, for everything you're doing to keep us safe. You're absolutely right about the masks. They're now even available on our buses countywide. But I'm very pleased to introduce Congressman John Sarbanes. I've known the congressman for many years, but I've really gotten to know him and work closely with him when I joined the county council in 2014 because our districts overlap. John's been a tremendous partner working on issues such as election reform, has been a tireless champion working with Speaker Pelosi to get special interest money out of politics. And locally, he's also worked really closely with me to promote business and redevelopment in Burtonsville and throughout the East County. We've partnered to hold job and resource fairs together and to coordinate on casework and to advocate for East County. So we're really pleased to have him tonight. Congressman Sarbanes serves on the Energy and Commerce Committee as well as the Oversight and Reform Committee. And tonight I'm really looking forward to hearing from him on updates about economic relief and our national strategy on testing. John is a nationwide leader in the effort to reform our campaigns and as I mentioned, get special interest money out of politics. And I'm very interested in his update on election preparedness, given that we have an upcoming election under unprecedented circumstances. And then after his update, we'll go to the Q&A. So please help me welcome Congressman John Sarbanes.
Thanks very much, Tom. Can you all hear me?
We can.
Excellent. Okay. Well, I appreciate the opportunity to join your call. I know you've been doing this on a weekly basis. I want to thank you for the outreach that you're doing to your constituents, which is obviously critical. I want to thank you for the work you've been doing really from your time as a elected official, whether it was in Annapolis or now serving the 5th District and the council in Montgomery County. Always super focused on constituent needs and priorities, which I think is what we all like to believe motivates us as elected officials when we get up in the morning. Obviously, very, very difficult times right now and challenging for everybody. I want to thank those who are tuning in tonight for doing all that you're doing to help us get to the other side of this pandemic, the other side of this health crisis that we're facing. Everyone's doing their part. Some of us can work from home. Others of us who are part of that essential workforce are getting up every day and going into places where there's a lot of risk and exposure. And that's, that the tribute that we pay to those essential workers every day, I think is something that's manifest. However, when I talk to them, while they appreciate the thanks and they appreciate the tributes, what many of them want is the resources, the protective equipment, the supplies, and other things so that they can do their job and do their job safely. I want to thank Sean for his presentation on the health side of things. That's really the guiding light for us, is the public health professionals at the federal, state, and local level. They're the ones that are going to help us through this, navigate it. Tom and I were just talking before we went live about how we're entering a very kind of tricky time now, because as people reach for some return to normalcy and start to think about what does it look like to open up our economy and our country again, we're going to have to be super focused on the guidance that we get from the public health professionals, because we're going to be navigating a lot of different dynamics right now. So, Sean, thank you for your presentation, and thank you for the work that you do. I just wanted to touch briefly on some of the key pieces of the federal relief that we brought to bear. As many of you know, in 5 separate packages of assistance that we have, or 4 rather, that we have passed since this pandemic broke out, we've sent almost $3 trillion to people out in the country. And we've sent it in kind of various baskets of support. And I think many of you are familiar with these, but let me go over them quickly. On behalf of individuals, the federal government is either direct depositing or mailing out checks in the form of direct payments to people all across the country, about 180 million checks going out. $1,200 for single filers or for individuals, $2,400 for those who file jointly, $500 additional dollars for dependents who are 17 years or younger. So a family of 4 with 2 dependents could get up to $3,400 of those direct payments. If you're somebody who has direct deposit of your tax refunds or otherwise is sort of electronically connected to the IRS, you may have gotten your direct payment already. I know a lot of those have already come into people's accounts. If you're somebody who doesn't file electronically, then you'll be part of the checks that are going out 5 million at a time every week, beginning really this week, the beginning of May, and going forward. And then Social Security recipients have opportunities for direct deposit because they have that relationship with the Social Security Administration and so forth. So there's a lot of different ways that those dollars are getting to people. If you haven't received your check yet or your direct deposit, there is a way to go to the IRS and check on the status of that rebate or direct payment. And I encourage you to do that. I'm happy to take any questions about that when we get into the Q&A. The other most important way that we're getting assistance out to individuals is through unemployment insurance benefits. So here's the challenge. We have authorized and appropriated billions of dollars to go out to both extend unemployment insurance from 26 weeks to 39 weeks for people, but also expand the amount of that unemployment insurance by $600 a week. So we're pushing a lot of dollars out the door from Washington, but that goes on to systems at the state level that aren't used to processing those kinds of dollars. In fact, in any given day, many states are now processing dollar amounts that they don't even see over the course of a whole year. And that's because of this severe economic disruption and a lot of people now who've been thrown out of work. The Maryland Department of Labor Licensing and Regulation, which administers the unemployment insurance program in our state, has been working to stand up a one-stop shop for people that are applying for those benefits here in Maryland. I encourage you to go to the site. I acknowledge that there have been some glitches over the last couple of weeks as they've tried to get that in place. Again, that's a function of the crush of claims that are coming in. but I think they're working those kinks through. And the most important thing for anyone to know is that from the time you, when you make your application, even if there's a delay in getting your benefits, it's retroactive to the point at which you became unemployed. So those benefits will reach you. So those are things that we are trying to do to help individuals around the country. Those dollars are flowing from Washington. As I say, there's always kind of a tension between getting the dollars out the door quickly and making sure all the systems can handle it well. But we are continuing to push those dollars out. And I want to also make this point, Tom, for your listeners. We are now looking at what the next round of federal assistance is going to look like, what that package will be. There's an understanding that we're going to have to further extend the unemployment benefits because people continue to be out of work as a result of this pandemic. And there may also be, we're pushing very hard for some additional direct payments to flow out to people in the way I just described. So there's a recognition that what we put in the pipeline in terms of unemployment benefits and unemployment insurance benefits and direct payments is not enough to carry people through. We're going to have to replenish that. On the small business side, we also obviously want to help the tens of thousands of small businesses across the country that have been so severely impacted. The method for doing that is 2 programs through the Small Business Administration. One is called the Economic Injury Disaster Loan, EIDL loans. Those are a traditional loan product through the SBA where you can get up to $2 million of relief through loans. There's a $10,000 advance there, which is an outright grant. That's been oversubscribed, as you can imagine, because of the need. We also established a new program called the Paycheck Protection Program. This is the notorious now PPP program. Again, the challenge here was a lot of money going out the door, almost over $600 billion in 2 tranches have gone into the PPP program. And what that allows employers is if they retain their employees, they can get up to essentially 2+ months of that payroll covered. It's a forgivable loan. So it's a very important support for those businesses that qualify. A lot of businesses applied for that. Within about 10 days to 2 weeks, the first $250 billion was gone. That's why we had to come back and replenish it. We did make sure in the second round that we reserve some dollars for smaller community lenders, what are called community development financial institutions, and others who have relationships with the smallest businesses. And Tom, you and I know that in East County, there's a lot of very, very small businesses, a lot of entrepreneurs, innovators who start these small businesses and are really right on the edge. So we wanted to make sure that there were dollars flowing to those businesses. And the reports are that reserving those dollars seems to be making a difference. It doesn't mean everybody's gotten their application responded to. It doesn't mean that every small business obviously has gotten the support yet, but it's an improvement over the first round. Unfortunately, as many of you saw, there were some businesses that are bigger businesses that found a way to capitalize on this PPP program. And I think that left a lot of people with a bad taste in their mouth because they're figuring this is taxpayer money going out. This is my money going out the door. It shouldn't be going to people at the top of the food chain. It should be going to people who really need it. So we're going to make sure there's some rigorous oversight and accountability requirements in place so that these dollars don't turn into bailouts for bigger businesses, but find their way to the businesses that really need it. And again, in this next package that we're putting together right now, I was on a call today discussing it with members of our caucus in Washington. We're going to put some additional safeguards in place to make sure that the smallest businesses are the ones that are benefiting from that. The last sort of two major rounds or categories of support that have been coming out of Washington are to support one is to support our healthcare providers and hospitals, which obviously need this because they're on the front lines. The second is state and local governments. And all the good things that Tom talked about that Montgomery County is trying to do, the state of Maryland is trying to do, that gets very tough under these circumstances because there's a lot of extra expenses associated with meeting the pandemic. But because normal activities aren't happening, a lot of the revenues that a county or the state would normally see have dropped significantly. So I was just on a call this morning with some local leaders and state leaders in our delegation, including your county executive, Mark Elrich, where we are urging in this next package a significant infusion of dollars to state and local governments. Those are not faceless bureaucracies. Those are police officers, firefighters, first responders, teachers, social workers, all the people that serve our community every single day. We got to make sure that they have the resources they need to continue providing those services. I've already talked to you about sort of the next round of CARES. We can have questions on that. I do want to speak just briefly before we go to the Q&A about pushing hard for a national strategy on testing. You heard Sean talk about how that's really the prerequisite to anything else that we're going to do in a steady and deliberate way to respond to this pandemic and get back to some kind of normal situation. We need the testing in place. We insisted in the last round that $25 billion go for testing, and we demanded that there be a national strategy for testing. We're going to continue to insist on that. I can report based on a call today I had with Admiral Giroir, who's in charge of the testing program at the federal level. They seem to be making progress on that. No quick fixes, but I think the capacity is going up with each passing day. We want to get to where we're not having states or locals competing with each other for these important tests, but it's all part of a coordinated national strategy. Same goes for acquiring personal protective equipment. It doesn't make sense to have people competing with each other. Let's put in place a national plan. We didn't have that coming out of the gate. We're trying to make that happen now. We're going to push hard on the administration to keep that as a #1 goal. Finally, on election preparedness, we want to make sure in the next round there's significant dollars coming to states across the country and into localities, to those officials on the ground who are proud of their job as election officials and want to run an election and want it to be done safely. And they're under a lot of pressure now because we need to expand voting by mail. We need to provide for early voting opportunities. And for people who can't access vote by mail and need to vote on election day, we got to make sure that we're providing safe places for them to exercise their franchise. In a democracy, voting is an essential activity. We have to do everything we can to protect that opportunity. We've got a primary coming up on June 2nd. I'm happy to talk about some of the sort of finer points of that when we get to the Q&A. Again, Tom, thanks for the opportunity to be with you tonight. I'll hand it back and we can get to questions and answers. I think you're still muted, Tom.
Right, sorry, Congressman. Thanks so much for that update. And Dave, I think you're running the Q&A portion.
Yes, that's correct. I also wanted to recognize District 14 State Delegate, Pam Queen, who's joined the call. Pam, feel free to unmute yourself if you'd like to just say
Yeah,
hi.
terrific. Welcome, Pam. I hope you can introduce yourself.
I'm here. Good to have you here. Thanks for sending the invite. And always good to hear from Congressman Sarbanes. A lot of good stuff that's happening. And Tom, you know, you're a superstar in our area. So we appreciate all the work that you and your office do to support our constituents. So
thanks so much for joining us. Do you have anything to add about what you've been working on in District 14?
Oh, well, we've been doing a couple things. We're trying, we get all the information from the state standpoint on, all the governor's stay-at-home orders and making sure we get that information out to folks. So we have been focusing a lot on that. We've been hosting our own town halls. And so, listening to the issues that our constituents have, especially around unemployment. That's been the biggest issue, trying to make sure people get through the new Beacon one-stop portal for unemployment insurance benefits. So that's been a major piece for us. We've been focusing a lot on, again, making sure we get the necessary equipment and testing done at some of the senior living facilities that we've had. We do have high numbers, especially in our county, in our district. So we've been working with that. The other thing I think you all know, we've talked about helping business with the Great American Takeout, the Takeout Tuesday. So we've been supporting restaurants in East County on Tuesdays. So that's been the other push. And then I guess the last thing we've been focusing on, that although we're staying at home and staying safe, please don't forget to respond to the 2020 census. Our response rates are kind of down now. In Montgomery County and East County specifically, we want to make sure we get those numbers up. So those are the key things I wanted to convey.
Right. Congressman, everybody who doesn't respond to the census costs Maryland, what, $18,000?
Yeah, I mean, it's all about power and resources, and it's really important, particularly now under these circumstances, that people respond through the mail and online. We want to get those percentages up. So when it comes to doing the outreach on the ground and potentially having to do it again under tough circumstances, those numbers aren't as high and we don't have to chase as many doors that way. So it's a huge undertaking, major operation. If you think about it, the two most important ways that people register their voice in a democracy, the census, which happens every 10 years, and a national election, are happening at the same time, and they're happening in the midst of this great challenge that we face. I view it as a challenge. I think we can pull off both of these things because we have to, but it's going to take a lot of cooperation and people stepping up as much as they can. So Pam, thanks for all that you're doing. Really appreciate that.
Thanks, Pam. Back to you, Dave.
Thank you.
Great. So let's jump into questions. Our first question is from Gary. Gary, can you unmute?
Yes, this is Gary Klauber from Silver Spring. There was a lot of press and a lot on TV when the governor got 500,000 masks and maybe some other PPE that he arranged to buy from South Korea. Has Montgomery County seen its fair share of those, or are we going to be getting them, or what's going to happen to those?
Gary, thank you for the question. We anticipate we're going to get our fair share of those. We do. And I'm grateful to the governor for his leadership in a lot of areas, and particularly in securing those test kits. At first, it appears, you can't just use a test kit by itself. You need the swabs and the receptacles. You need a trained staff person to administer the test. You need personal protective equipment for the staff person. And we've been lacking in some of those other areas as well. And sometimes, depending on the type of test, you need reagents to make the test work. So there's been a limitation in some of those other areas. That's, sort of no fault of the governor for his initiative getting the kits in the first place. We're, as I mentioned earlier, working with a lot of our local providers and, working with manufacturers all around the world to get our share of the kits that we need.
Thank you.
Thank you.
Great. Our next question is from Helga.
Helga?
Yes, sorry. Hi. It took me a while to unmute.
No worries.
So I just wanted to ask, there are so many residents that are willing and eager to help and support making homemade masks, donating food, or even donating money to those in the most need right now. And I just wanted to see if you had any guidance on where people should go to supply the things that they can provide to the people in the greatest need right now.
That is a fantastic question. I would, we're all lucky to work in Montgomery County, where we have, really the most talented individuals in the whole country. There's 3,000 counties in the country, and I think nobody has either the education level or the talent base that Montgomery County has to draw on. There are so many things we still need, and I would refer everybody to the Montgomery County Volunteer Center, which is it's off the county website, montgomerycountymd.gov/volunteer center. But if you just Google, if you don't remember that and you Google Montgomery County Volunteer Center, you'll find it. And you can sign up there. They'll ask you about your skills and what you're interested in doing, and they'll plug you into all kinds of things that we need to happen to help our neighbors.
Hey, Tom, can I just say, I just want to, I agree with what you said. I think that's the best place to direct people. But I just want to thank Helga, because she's very representative of a lot of the calls that are coming into my office. Mm-hmm. Obviously, we get many people who are calling on their own behalf and they need help with one challenge or another. But there's also a lot of people who are calling and asking exactly what Helga did, which is, how can we help others? In addition, I get people calling me all the time saying, we've got to do what we can to protect the frontline healthcare workers. So what this challenge is showing us is the generosity in our communities and how people are stepping up, reaching out and giving a helping hand to other people. And there's a lot of resources and information that can help direct people to the place where they can make the most impact. So thank you for that question.
Great point. Thank you.
Great. And our next question is for Sean from Sandra. Sandra, if you can unmute. Well, let's come back. If you can unmute.
I got it. I got it. I'm sorry. Yeah, I live in a senior high-rise in downtown Silver Spring. When can we expect testing to reach people living in places like this? I don't know if it's considered congregate or not. It's independent living.
Right. Well, I mean, certainly that is one of our goals, is to be able to expand out and have testing available to anybody who needs it. Right now, I think the first mission is to get it out to all of our folks who are at risk in our other congregate skilled nursing facilities. We have seen a truly unfortunate number of cases in these facilities, and we're working very actively to try to control those. But I think that at a certain point, when we have enough testing, we would definitely advocate for trying to get individuals who are in the types of buildings that you're in. Obviously, we don't have as many as New York City, which I think has been helping us a little bit, that we have fewer, but so that is a good point of where we could focus our efforts.
Can I ask, can they at least get the staff tested? There are only 4 staff people here, but they do come around delivering meals now.
Okay. Well, we'll definitely, as I mentioned earlier, our next phase is to try to make testing available to all of the essential workers. And we would set up a portal where different organizations throughout the county could register their individuals as essential workers, and then we'd be able to test them. So that would be one way that we would work on that with you all.
Okay, thanks.
Sean, let me just mention, we were on this call this morning. I think this is sort of a breaking news item with Admiral Giroir, and he mentioned that they are elevating the needs of nursing homes and long-term care facilities across the country into this kind of national deployment strategy around testing and PPE. And so I think you're also going to begin to see a coordinated federal response there that can help support what is happening at the state level and the local level in terms of reaching out to those facilities where obviously the greatest at-risk population is concentrated. So that was very good news for us today on the call at the federal level. And I think as information about that comes out, we're happy to make sure we get that to you and to Tom.
Thank you.
Thank you, Congressman. And Senator, let me just remind everybody too, regardless of what happens with multifamily housing as a category, if you have symptoms, you should definitely see your primary care provider and try to get tested. If you do have symptoms, if you don't have insurance, you can get a test through Montgomery Cares. If you are in touch with staff there that have symptoms and you think and want to be tested, you should get in touch with Montgomery Cares, or certainly just you can be in touch with our office offline and we'll try to direct you to the right place. But regardless of, I wouldn't wait for what is happening for all apartment buildings as a class. If you know people who have symptoms, we want to get them tested.
Great, thank you. So our next question comes from Facebook Live. It's from David. It says, please let us know what you learned or have observed about the vote by mail election in the 7th Congressional District and any suggestions you'd offer to make it better, including how to increase voter turnout.
So great question, super timely. If you look at the 7th District election, so that was a special election. And under certain provisions in the Maryland law, it was conducted essentially all by mail. There were 3 in-person voting locations on election day, one in each of the 3 jurisdictions, Howard County, Baltimore County, and Baltimore City, that functioned both as drop-off centers for people that were returning vote by mail, as well as in-person for those who needed special accommodation or just hadn't been able to access the vote by mail. What we're going to be very interested to see are things like how quickly can the count be done, because they're still counting these ballots. That's going to give us an idea of what the kind of lag time is when we get to the June primary for getting final results. But in particular, what does that suggest when we get to November, not just in Maryland, but across the country, in terms of how quickly results will be available? If we have significant amounts of people voting by mail, you have to build in some lag time in terms of, declaring who's won an election at whatever level and so forth. So that's going to require some education of the public to be kind of in that mode. Secondly, what we saw in the 7th District, and we anticipate for June 2nd and into November, is there has to be a lot of education of the electorate around how you vote by mail. Now, normally in a place like Maryland, you would have to request an absentee ballot. It's no excuse in Maryland. The Maryland Board of Elections has arranged in the 7th District race, and this will be the case on June 2nd for the primary across the state. They're going to affirmatively mail out a ballot to every registered and eligible voter, but some people aren't going to get that ballot. Some people may have moved since the address that the state board has on file. So there's going to be a lot of different sort of hoops to jump through potentially. And I think it's going to be incumbent not just on election officials, but on elected officials like myself and Tom and Pam Queen, as well as people that just promote civic engagement to try to provide as much education to the electorate as we can. What I'm very interested in, and to be honest, a little concerned about, is that there are communities that just don't access vote by mail as easily as others do. And it's going to be interesting to see when we get the results back from this 7th district race, where were the highest places in terms of the ballot being returned and where were the lowest places percentage wise, because that could tell us come November that we really got to focus on providing those safe in-person voting opportunities in certain communities that might not have the same kind of access to the mail ballot. So we're going to learn a lot, not just from the special election we just had, but we're going to learn from the June 2nd experience. And we're learning from things happening all across the country, including from like the train wreck and chaos that we saw in Wisconsin recently, because they didn't have their act together in time for that election. So a lot to do, but we got to bring resources to bear if we're going to hold an election in November where everybody has the opportunity to cast their vote.
Great, thank you, Congressman. Our next question is from Kim. Kim, can you unmute? And then we'll take Scott afterwards.
Yes, thank you. I just wanted to make a comment really that thank you so much for having these updates. It's really nice because it's really hard to trust some of our federal resources. And so it's really nice to have this local information. And then just another comment for Representative Sarbanes, and I put this in the chat box, but I advocate on behalf of people with disabilities, and I was really happy to hear as part of your presentation that you are, that folks are now focusing on not just nursing homes, which of course need a focus, but also the home and community-based settings. And in the 4th federal COVID package, we hope that you will support additional funding for those home and community-based services. Our providers in our area that I've talked to do not have the necessary PPE for their direct support professionals. And that is putting direct support professionals at risk, as well as folks that are living in the community. So I would just appreciate your support for that. Senators Casey and Murray are taking the lead on some of that language, as well as your colleagues in the House, Representative Smith and Doyle. Thank you, thank you, Councilmember Hucker, for holding these.
Kim, rest assured, I was on a call about 3 hours ago with our caucus, and it was a briefing from all of the committee chairs who are putting together the components of what we want to see in the next round. And the issues you just raised about providing support for caregivers in the home and others who need those kinds of resources coming behind them. That was one of the topics that was talked about. It's something we're pushing very hard for in the next round. So hopefully we can achieve that, because I think we do need to recognize the incredible service that those folks are providing. So thank you for bringing that up.
Thank you.
Great, so I'll recognize Scott, and then our next question will be from Ryan, and then Laura. Scott?
Good evening, Congressman. Longtime listener, first-time caller. When this emergency is all over, how do we prevent such a poor response to a national problem from the federal executive branch?
Well, I'm going to restrain myself and not talk about one way to have a better response is to have better leadership at the top. Although I think that's fair, because I think we got a late start, and I think there was some denial going on in terms of the team in the administration. But there's some other structural problems that contributed to the fact that we were flat-footed, that we missed windows of opportunity to do containment and had to go straight to mitigation strategies, like having people social distance and stay at home, and all of the economic consequences that come from that. One of those problems is that we have a strategic national stockpile, but we had not been stockpiling supplies into that resource for years at the levels that you would need to have a fighting chance coming out of the gates on this kind of a public health crisis. But not only did we not have the stockpile filled up, we have offshored the manufacturing of most of the critical supplies that we would need to be in that stockpile. You can't do both. If you're not going to manufacture the stuff here and have those supply chains in place, the very least you got to fill up the stockpile, and we had done neither. So we're trying to catch up on both fronts right now. So in terms of being better ready for the next outbreak, and frankly, the fall and the winter could be another spike in this. The public health professionals are cautioning us. We've got to put in place, get the stockpile filled. We've got to get these supply chains in place, manufacturing capacity ramped up. That's where we've been urging the president to use the Defense Production Act, which would really require companies to step up and get behind this kind of on like a warlike footing. But the most important thing, I think, going forward is this has laid bare blistering inequalities in our society in terms of access to baseline health care and economic opportunity. That tends to track those who don't have access to political power as well. But we need to build a public health system in this country that begins us at a much higher baseline of capacity than what we're seeing now. And the one lesson I hope we draw from this is, on the other side of it, let's put in place the kind of infrastructure, health infrastructure, public health infrastructure, so that when this comes at us again, we're in a much stronger position to respond. So it's a terrific question. It's a huge challenge. But hopefully the lessons learned from this will get us positioned well for what we need to do next.
Thank you. And I see we have a cameo from Will. Hi, Will. Our next question is from Ryan.
Hi, this is Ryan Wilson. We heard some statistics earlier about hospital bed availability. A couple of questions on that. Do we know whether that's going to be enough going forward? Is that number going up, going down? And then follow up to that, are those beds being evenly distributed throughout the county, or are we seeing like higher numbers in some part of the county and others?
Why don't I start, and I'll let Sean jump in and correct me anything I say that's wrong. My understanding at the beginning was that we would need 600 additional beds to meet the surge as it was projected, and up to 800 to meet the worst case scenario. And the good news is we're now up to the 800 additional beds that were envisioned. And one huge, elective surgeries and other things like that have been postponed. But one big accomplishment was reopening Washington Adventist Hospital in my district in Tacoma Park, which is like 178 additional beds that are now available that weren't available at the beginning of this crisis. Sean, what did I leave out?
No, I think you covered the major points. I'm looking at a graph that we put together on Friday, looking at the Maryland ICU and acute hospital beds. So this was looking across the entire state. But we did notice that we have it has been going up over time, obviously over like the last 30 to 40 days. But we did see a couple continued decreases in the last few days of last week. And then, of course, we know over the weekend, there is some drop off on that. But we're seeing a steady rate of individuals recovering and moving out of our hospitals, which is very encouraging. But I think you covered all the finer points of the capacities.
Great, thank you. And just a quick reminder, if you haven't done our survey, please check it out in Zoom. You can click polling. Our next question will be from Laura, and then we'll take a question from Michael Glasby, and then Barbara Sosnick.
Hello, this is Laura Stewart. I'm in Silver Spring, and I have a question about stimulus. I understand that states and local governments are up for more stimulus. I heard that maybe an infrastructure bill could be coming out at some point. I want to make sure that schools aren't missed in that infrastructure bill. And I'd like to know, is there any chance that maybe construction funds could come to state and local governments to shore up our school infrastructure?
So thanks for the question. We'll have heard about infrastructure because for a while, this next round of assistance that was coming from Washington, this next stimulus bill and assistance package was largely being talked about as an infrastructure bill. I think we realized that while there be some infrastructure investments there, for example, we want to try to expand broadband because obviously with people being heavily reliant, particularly students on broadband for instruction at this point, we're recognizing that there's huge gaps across the country and in every state, and we need to try to ramp that up. So that's very connected to the situation that we're in right now. But I will say with respect to helping K through 12 education, the best thing we can do is to bring robust dollars into states and local governments, which is really at the center of this next bill, because we understand that, you know, teachers, social workers, firefighters, police officers, first responders are all on the line here. And if we can get dollars flowing. So for example, I think Montgomery County got about $105 million in the last round. But there's some strings attached to that that mean it can't go to certain kinds of services, certain categories within the budget. We want to provide more flexibility so when these dollars do get to local governments and to states, they can use them in a more productive fashion. And we're going to put that in the next round. And then we're also going to add a significant amount of dollars because we know that state and local governments that have to balance their budgets and so forth, they're cratering right now in terms of their revenues. And so that is probably the #1 priority in the next bill. I think resources will find their way to some infrastructure investments, but right now I think it's still very much focused on providing relief and assistance and support to those who've been leveled by this crisis. So thanks for that question.
Thanks, Laura.
Great. And our next question is from Michael.
Good evening, council member.
Hi, Michael. Great to hear from you.
Good to hear from you. I have a question regarding the Montgomery County Small Business Public Health Emergency Grant. How's that program going, and how can you find out the status of your application as to whether or not it's in the queue or just where it stands at this point? And I guess the last part of my question is, are money still available in that particular grant to be distributed?
Those are all great questions. Thank you, Michael. And it sounds like you applied, so that's good news.
I did.
And I hope our office reached out to you. Dave and my staff made calls to about 650 small businesses that we're in touch with to encourage them to apply. And thank you so much, Michael, for all the good work you do through Mount Jezreel to provide emergency food assistance to all the families facing food insecurity. And please give my best to Pastor Spearman.
I will.
The program has been, in a way, very successful because it has great need. I'm glad we got it stood up okay. I wanted to dedicate more of the money to retail and restaurants. As I mentioned, my colleagues agreed on 25%, and then Councilwoman Navarro and Albornoz and I agreed on another $5 million for retail and restaurants. So now 10 out of the 25 million are set aside for retail and restaurants, which is good because they're getting hammered so badly, and they're critical to our local economy. If you put in the application, the sort of bad news for you and good news for the program is we've had 6,000 applicants come in. And we've finally gotten some clarity from the county executive and decisions on how the second tranche of money is going to be appropriated. So there's going to be over 1,000 recipients that are getting at least $10,000 grants. And then I think now it looks like several more, I hope, 1,000 they're going to get some grants as well. There's not enough money in it. We didn't know what was the perfect amount when we started. And also, we didn't know whether we were going to get reimbursed by either the state or the federal government. But now it sounds like we're going to get, we can expect to be reimbursed by the federal government, which is great under the CARES Act. Thank you, Congressman. So I'm certainly going to be pushing to add more money to this program because the hard part of setting up a new program is setting it up. And it's a lot easier to add money to it later, especially if you know that the federal government will reimburse us. We've now received $183 million from the feds for COVID relief. So we can appropriate that for, many different things, including small business assistance. And I'm going to be asking my colleagues to add more money to that program. So I think you should sit tight. We can look into, if you just email us, and Dave's listening, so we can try to look into your grant in particular and see if we can get some information from the finance department. Yeah. But the first grants have already gone out. I've heard some thanks from some of the small businesses in our district that they're receiving the money already. They've been notified, and the rest are going to be notified over the next week or so. So sit tight. We're happy to check on it. And I'm hoping, even if you don't get money in this initial round, I hope we'll be able to add money to the program and get additional money in the future.
Would be appreciated. I will send the information regarding our application to Dave as soon as this session is over.
Terrific. Thanks, Michael.
Thank you.
Great. And just one final reminder to take our survey. And we will share the presentation as well as the slides with resources with everyone who registered. Our final couple of questions. Unfortunately, we did have more questions than we're going to be able to take tonight, but you can follow up with us. The 10th question on the survey, you can mark if you'd like a one-on-one phone call from our office, whether it's COVID-19 related or a general inquiry or constituent service request, and we will follow up with you this week. Our next question is from Barbara.
Thank you so much. My big concern is that there are thousands of Montgomery County residents, and probably this is true throughout the state, who I feel are getting sicker and possibly even worse because people are not getting the medical care that they need for non-coronavirus issues. People are terrified to go to the doctor. I'm terrified to go to the doctor. And I think people are terrified to go to, emergency rooms, trading, one serious thing for what's perceived as, a really serious illness of coronavirus. And I'd like to know what, if anything, or what thought has been given to having, separate emergency rooms or separate facilities. I realize that it's not an exact science, and there are thousands of people out there who are positive and don't know it, but at least to make some effort to try to segregate people, to do a better job of not just testing nurses in hospitals, but testing providers and their staff, so that, again, people don't wind up with heart attacks, and there are plenty of other so-called elective surgeries that are not exactly elective. It's not necessarily like, plastic surgery, some serious things that if they're not taken care of for months and months and months can wind up being life-threatening. So that's my question.
Sean, you want to handle that one?
Yeah, sure. Well, no, I think that I think you partially answered it when you were asking the question, which is this is why it's so important for us to be able to expand testing to the essential healthcare personnel. And it's not, this will never be a single point in time that we test everybody and we're done. We'll have to redo it over time. again, to have those assurances. And it's, a lot of this is primarily because there is some asymptomatic spread of the disease. I don't know that we are looking at, I guess, having separate ERs. That would be a challenge, although we certainly do have cohorting of patients at our hospitals and at our nursing homes and other care facilities, which makes a lot of sense to reduce risk and reduce spread and save on the very limited amount of PPE we have. So we are doing that to a degree. And we are concerned. We know that hospital emergency department utilization's down, and it's not just the elective surgeries. So we do hope that people are taking their health seriously. We work closely with our fire rescue service partners to look at transports and look at data from that. And while the usage is down, the very serious outcomes and acute disease is up at our emergency departments. So people are having serious episodes and are going to the emergency departments for those. But everyone should keep in mind the preventative health measures, and we're all hoping we can get back to that standard of care.
Can I just ask a real quick follow-up? What about having mobile, lab testing, not necessarily for coronavirus, but for blood work, and mobile, not just labs, but maybe even x-rays and that sort of thing, so that people don't have to go to facilities. And I'm not just talking about emergency rooms now. I mean, for important follow-up care. Any thought to that?
Well, I do think actually that, and I'm not going to be able to name the specific healthcare partners, but I do think that some of our hospitals have some services that they've done external to the hospital to help prevent people from coming into the facility, whether it's filling of prescriptions or some other less invasive type procedure. So that is something that has been looked at, and I think we'll continue to look at all the options that make sense.
I do want to mention that with coronavirus testing, Jim Clyburn, our majority whip in the House, is leading an effort to deploy mobile testing units around the country. This is based on something they did in South Carolina decades ago to address a high rate of diabetes in the community. It's particularly focused on getting those resources into these communities where we're seeing disproportionate impact from the coronavirus. So this idea of getting the services and the resources out to the community so people don't have to come to the hospital or to a clinic is certainly something that's getting a lot of attention, and I think can be deployed a lot of different ways once that infrastructure is put in place.
Thank you, Congressman. And due to the time, we do have to cut questions short. We have our Stay Connected slide up with contact information for Council Vice President Tom Hucker, as well as Congressman Sarbanes, and a great resource page for the congressman, as well as the county's portal. And we will send these slides out, so you'll also have our resources slide with links. Any closing remarks?
Yeah, I just wanted to thank you again, Dave and Tom. I know Pam Queen was on for a few minutes. She may still be on, but I want to thank you for all the work that you're doing. Hey, Pam, in Montgomery County, I'm very proud to represent East County. It's a set of communities, and then a community as a whole that does reach out and engage with the elected officials there. It's something we all benefit from, and we're doing our best to bring the services and resources we can. I will say this, I am beginning to feel that we are coming off our back foot with this pandemic, and we're starting to lean onto the front foot. That doesn't mean that the challenge is over. There are many tough days ahead, but we're starting to get our arms around this thing. And I think Americans have shown that they're up to the task of this. If we stick together, if we work together, we're going to get to the other side of this. And we're going to lose some people along the way, and a lot of people are getting sick, and a lot of families are being disrupted. But I can feel that we are beginning to lean into this and getting past the initial shock of this kind of hurricane hitting us. So thank you all for what you all are each doing in your own lives, in your own homes, in your own workplaces to help us with this challenge. We'll continue to do everything we can representing you at the federal level to provide support and resources. Again, Tom, thanks so much for the opportunity to join you this evening.
Thank you so much, Congressman Sarbanes and Sean, for your updates. And I want to thank all of you who joined us for your great questions, for joining us. The county government and my staff and I are definitely here from you, and I know that's true of the congressman as well. So please don't hesitate to reach out, whether it's by phone or mail or text. The contact info is all there on the slide. I know this is a scary and uncertain time for all of us. It's a huge challenge to our community and our entire county, but it's also a call to action. And you know, you sort of see the character of a community in times of crisis, and it's really been inspiring to see so many residents answering the call by mobilizing and donating and stopping everything they're doing to help those in need, to deliver food assistance and many other things. This includes our healthcare providers and our first responders who are on the front lines, working with our residents to try to help them recover and keep us all safe. I also, certainly we should thank our teachers. This is Teacher Appreciation Week, who have had to stand up a distance learning program with very little preparation that is doing its best to educate 160,000 students in Montgomery County. I'm really proud to live and work in a county like this that is responding so well in the midst of a global pandemic and all the stress, because we've seen so many residents really sacrifice what they're doing and help others. So please stay in close touch with us. Let us know how we can be helpful. RSVP to future town halls at tomhucker.com/coronavirus. Please stay safe and stay home and stay connected to us. Thank you so much again. Thank you, Congressman.
Thank you.